So today I'm going to be talking about iPad usage for admitted patients on hospital units. So the scenario I chose was a voluntary presentation for a new informatics tool in the hospital. So being in the hospital can be a very scary, nerve-wracking, even intimidating experience for a lot of patients. So introducing something like an iPad to check out can help ease their pain, their comfort, help with distractions, things like that to help ensure that their hospital stay is positive. So obviously, the first barrier that I think of when I think of, you know, having an iPad is the cost of it. So the first con is according to apple.com, starting at a regular iPad, the price starts out at $329 and it goes up from there. iPad minis are $399. But to play devil's advocate, we don't have to get brand new iPads. We can get donations, we can get used ones that are in good condition, things like that. But price is always a factor to think about. Obviously, most people know the maintenance and the updates and keeping up to date on that can sometimes be take time and just be a nuisance and become annoying like that. And then thirdly, another con is making sure that the iPads do not become encrypted and that the patients are only visiting appropriate, pages, and so that none of the iPads get viruses or things like that. We would have to maintain blocked websites, and so that can be a nuisance as well. But the benefits to this are it can help with patient education. They can watch modules. We can have them read articles and things like that to help them understand their diagnosis without wasting paper. Protection, that's a huge one. Something obviously that we know that's going on right now is the COVID-19 pandemic. This quote from mhealth.org states, "The extra level of protection a video chat provides, an ER doctor can assess a patient with no risks of exposing themselves to the virus or carrying it to the next patient." So basically what this is saying is if the doctor needs to just do a routine assessment on a patient, that is stable, obviously, instead of exposing themselves, or like a quick assessment, instead of exposing themselves to the patient and then to their next patient and, possibly bringing it home, they can do it over a video chat and not pass it on. And then finally, another thing is family conferencing. Like I said before with COVID-19, these patients that are in the hospital as of right now are alone. And I think that it would be a great idea to have video chat available for family conferencing, especially for those patients that are facing their end of their life. And then eliminating language barriers is another pro. So maybe if the interpreter cannot be in the room with the patient, we can do video chatting again to disqualify that language barrier. And then a huge one that I really love is that distractions can really help the patient alleviate pain, alleviate anxiety, promote comfort, and just overall make their hospital experience better. So the implications to this in the profession, basically this tool can be used to help, especially nurses, enforce educational needs, and in turn this can also help with discharge implications. So maybe for a patient who obviously can read, or for a family or a caregiver, prescribing modules and educational tools to understand, new medication administration and adverse effects and things like that. So then that decreases the time for the nurse to be in there with the patient, especially on medical surgical units. Sometimes the nurses do have a lot of patients. So then that leaves it up to the nurse to answer up with following questions that the patient may have. Like I said, this also just really helps with distraction and comfort. We learn in nursing school maybe to try other techniques. So distraction, sometimes that can help pain. It's always worth a shot. According to seattlechildrens.org, when facing a new diagnosis, we find that families and caregivers want to assess educational content on their own time with their children resting or watching TV. So sometimes as a caregiver, this can be nice. Not everybody has a cell phone. Maybe the caregiver doesn't have data or they run out of minutes. This is a great tool for them to use to contact their own family members and do their own research while they're in the hospital. And then future implications, basically we could have a charging station and the iPads could, would stay there, and it would be up to the employees to sign an iPad out. Obviously they would not sign the patient's name. They could put like a room number and then the time they signed it out, and it would be up to the employees to monitor that. Some hospitals have actually already implemented this. The unit that I worked on last year had just started this right as I was leaving. From what I witnessed, patients absolutely loved it. They were able to access their MyChart, look at their test results, things like that, and even contact their physician through the MyChart messaging. So to conclude, iPads can be used to improve patient care, education, engagement, and even comfort in the hospital. And these devices have significant potential to improve patient education and engagement in the hospital. So to end this off, I just want to ask you, if you were a patient in the hospital, is this something that you would utilize? Can you see yourself utilizing this? Say you did have your phone in the hospital, but you forgot your charger and you can't get anyone to bring you one. Is this something that you could see yourself utilizing? And then my references. Thank you.